Welcome to Veterans and Labor working together to save the VA. I'm not going to waste time, but get right to the speakers. People will speak in this order. We begin with Suzanne Gordon from the Veterans Healthcare Policy Institute. Suzanne will be followed by Irma Westmoreland from the National Nurses Union. Bruce Carruthers from the Save Our VA Steering Committee will follow. And last but not least, Mark Smith from FUN, the National Federation of Federate Employees, will wrap up. Q&A will follow. So I want to read a statement, our statement of purpose from the Veterans for Peace. So I'll do that now. We, as military veterans, do hereby affirm our greater responsibility to serve the cause of world peace. To this end, we will work with others, both nationally and internationally. One, to increase public awareness of the causes and costs of war. Two, to restrain our governments from intervening overtly and covertly in the internal affairs of other countries. Three, to resist racism and repression in our home communities. Four, to oppose the militarization of law enforcement. Five, to end the arms race and to reduce and eventually eliminate nuclear weapons. Six, to seek justice for veterans and victims of war. Seven, to abolish war as an instrument of national policy. Eight, to promote a sustainable and peaceful world. To achieve these goals, members of Veterans for Peace pledge to use nonviolent means and to maintain an organization that is both democratic and open, with the understanding that all members are trusted to act in the best interests of the group for the larger purpose of world peace. So I'd like now for Bob Muhlenkamp to introduce those of us veterans to the third act, and welcome to the third act.
Well, thank you, Patrick and Steve, and for inviting it, and for Vets for Peace and Speak Up, and for Veterans for Sensible Priorities, and particularly for John Braxton, an old comrade who brings people together, for inviting us to this and for involving us in this. And we are sponsoring an event with you all on February 17th. I'll talk about that briefly in a minute. But first, I just want to talk a little bit about Third Act, because some folks here don't know about it. Bill McKibben, who many of you know about, formed Third Act about 4 years ago for seniors to work on the two existential issues of our time: democracy and the climate crisis and the relationship between them. Third Act organizes into working groups around the country. There are now 37 states, and affinity groups. And we, Third Act Union, are an affinity group, a network of 700 retired, and senior former union members, union officials. We see our mission in Third Act to first of all, involve more trade unionists in the work of Third Act and climate change and democracy. And second, to bring class consciousness to Third Act, including bringing the serious issues of working class people around climate change. That's our mission within Third Act. So on February the 17th, we, with you all, are sponsoring another forum about veterans, and we're going to focus more in that forum on the issues around veterans and active service members resisting Trump's illegal orders, and the relationship between militarism and climate and democracy. And honestly, nothing could be more relevant, given especially the statements by the Archbishop Timothy Broglio just a couple of days ago. I think you'll probably all know about this. He's the bishop for the military. And he said, basically, he didn't say basically, he said that military members in good conscience that it is morally justifiable to resist illegal orders from the military. So that's what we're going to do on February 17th. We want to invite you all to attend. If anyone wants more information about Third Act Union, about the forum on the 17th, please go to Third Act Union, I'm sorry, it's union at thirdact.org. Union at thirdact.org. So, Patrick, thank you for inviting us to this and participating in it. And let's get to this conversation. Thank you.
So, Steve, to speak about the labor working group.
Yeah, just before I do that, Jim, Bruce Carruthers is a panelist. He's trying to get in. I don't think he's gotten in. I've gotten an email from him that he can't get in, and John Braxton's trying to get in. So maybe there may be others. I don't know what's going on.
Suzanne.
Technically, Suzanne.
I just came in. I couldn't get in before.
Oh, okay,
no.
there she is.
I'm glad you can. Now, okay, let me say about Labor Working Group. The Labor Working Group of Veterans for Peace meets every 2 weeks, currently on alternate Thursdays at 11 a.m. Pacific, 2 p.m. Eastern, and a steering committee of 5 people meets additionally. We work to link resistance to attacks on workers with attacks on valuable services, such as with this webinar right now on the VA. We seek unity among labor veterans and other progressive groups, racial and gender equity, and support for immigrant workers. We build anti-militarism within labor through our People Over Pentagon campaign, Veterans in Labor for Sensible Priorities, where we have gotten 113 endorsements from labor unions and labor advocacy groups for a $100 billion cut in Pentagon spending. We publicize anti-militarist actions of workers, such as the many refusals of dock workers in Europe, North Africa, and the US to ship weapons of war. We work for labor issues to be more central within Veterans for Peace. And so if you're an interested Veterans for Peace members, join us. You can contact us at labor@veteransforpeace.org. Patrick.
And we also accept associate members,
Yes.
non-veterans.
Right.
Suzanne, are you ready to present?
Yeah, sure.
Okay, you're first.
Okay, and you wanted me to talk to for how long?
About 15 minutes.
Okay, so as you know, and is Mark Smith speaking as well? Smart.
Yes.
Yes, Mark and Irma are both speaking, and Bruce is still trying to get in.
Okay. So I'll just give a broad overview on the attacks on the VA, and I think people can fill in the labor aspects. But essentially, Doug Collins, who is a former Georgia congressman who is Trump appointed as the secretary of the VA, began his tenure by firing probationary employees, something like 2,400 probationary employees. And in VA, I think that this is across the federal government, although Mark, you can correct me if I'm wrong, but a probationary employee might not be somebody who, is just joining the workforce and never worked in the VA before, but also someone who may have worked for 20 years in the VA in one position and has been moved into another position. So that is something that probably, if we ever get a new administration and president and Congress, should be rectified, because Trump, of course, has taken advantage of all kinds of loopholes and gaps. And then he announced that he was going to fire 83,000 employees in the VA, which would be, the VA has about 400,000 employees, the Veterans Health Administration. And he said he was going to fire 83,000. He then backed off and said, because of there was a big storm of outrage, he said that he was going to only fire 30,000 or eliminate 30,000 positions, and those would not be filled if people, if positions were left vacant through attrition, or, you know, that people died, people retired, people left for other jobs. He's going to leave those vacant. He also canceled contracts for many. He just arbitrarily canceled hundreds, if not thousands, of contracts with outside contractors who provided critical services to VA. I mean, vendors. I mean, they were, for example, in Portland, in Taugus, at the Taugus VA Medical Center in Maine. He canceled a contract with people who monitor the safety of radiation equipment, you know, like x-rays and chemotherapy, I mean, radiation therapy and, you know, MRIs and so forth. And then somebody pointed out that these were necessary and they kind of went, whoops, you know. I mean, they just took this huge Joge like chopping axe or to all these positions. And then he canceled contracts of VA researchers who are on rolling contracts. They're on usually 3-year renewable contracts because they're sort of on soft money, and they're doing research that's critical research. And many studies were canceled in midstream. And I don't know if people know this, but the VA is the second largest research powerhouse after the National Institutes of Health. And so VA research is critical. I mean, VA pioneered the first implantable cardiac pacemaker, the nicotine patch, the first shingles vaccine, has a huge contract. It received money from millions, I think 50 million or something like that, from the National Prostate Foundation because it has a lot of prostates in its patient population. And these are people that you can study long term and answer vexing questions about. So that was another thing. And now, right before Christmas, he announced that he was going to essentially eliminate from the organizational chart, and Mark can correct me if I've got this wrong, something like between 25 and 37,000 positions that have been left vacant. So, you know, VA has always had a hard time, has had a very cumbersome hiring process that takes a very long time. And also, if something has just been hard to recruit for, the position could be desperately needed, but
Hey, Jeff.
the position could be desperately needed.
Going?
But
I can't
was,
stop.
I finally got on. He sent me a different link. Let me try to forward it to you. The
Bruce,
links I use wouldn't get on, so let me forward the last link. All right.
okay, Bruce, okay. All right, so essentially positions that are needed, an emergency room social worker, a health coach, neurosurgeon, whatever, but they haven't been filled for a certain amount of time. They will now be taken off the org chart entirely, and that position will disappear. And the VA spokesman, Peter Kasparovich, or I'm not sure how he pronounces his name, essentially they're arguing, well, because these positions weren't filled for over a year or whatever, nobody needs them. And that's not true. I mean, if you can't hire, or it's taking a long time to hire for a particular position and you don't get candidates, then that doesn't mean you don't need the position. And it's certainly not for the VA spokes PR person or Doug Collins to decide which positions are needed. And essentially, VA medical center directors were basically given the order that they had to kind of look at their staffing and pick one. You know, you can't have two from column A and two from column B. You have to eliminate just arbitrarily for no reason, but because they want to dismantle the system. And, you know, I think it's important for folks to understand that it's hard to hire it has always been hard to hire at VA, because VA pays less than the private sector. So, a social worker or a doctor could earn 40, 60, 100, $200,000 more, even three or four, depending, um, in the private sector than they could at the VA. So that's a disincentive. And now, since Trump took over the federal government, and you have this Doge, like, people sending folks like Mark Smith, who will speak to you in a minute, and folks Irma and so forth. They have worked in the VA for a long time. They're very dedicated. They sacrificed money, like they could earn more in the private sector, and they receive these email messages from their boss saying, literally, and I quote, "You're not contributing to American prosperity by taking care of veterans, and we wish you could resign. We wish you would resign and get and do more productive work elsewhere." I mean, veterans should be up in arms about this, whether they're in the VA or not. The idea that if you're working for a public system, you're not contributing to American prosperity. Well, you're not because of the fact that, you're working for a public program. And if they define prosperity as prosperity for the private sector, and the idea that you're not doing productive work by caring for veteran patients it's an outrage. And basically, the word on the street now is that the VA is not a good place to work, that the government isn't a good place to work, but the VA isn't, that they're trying to fire people, not hire them. So, on the one hand, Collins is saying he's trying to fill 40,000 jobs. And on the other hand, he's hiring 37,000, capping and not hiring. So, and this is a calamity. I mean, because people are leaving, people are, I know many people who've left VA who would have stayed. They perhaps older and have a wealth of information and wealth of institutional knowledge and patient care knowledge, and they might have stayed for another 5 years, 10 years, and they're leaving. People are leaving who have long careers ahead of them because it's a hostile workplace. And, one of the other things he did, and I just want to put a little spin on the perspective, is, of course, and I'm sure Mark and Irma will talk about this, but he's abrogated union contracts, kicked unions off the premises. And the danger here is that the abrogation of union contracts is conceptualized as some kind of labor management dispute that, doesn't have anything to do with patients or patient care. And nothing could be further than the truth, because when you deny people protection and psychological safety on the job and you create a hostile workplace, this is super dangerous for patients. I mean, this, if a nurse is afraid to say to a doctor, you're giving the wrong medication, or, a social worker or a housekeeper is afraid to say, you didn't disinfect this room. I wasn't given the ability to disinfect this room correctly and thus prevent hospital-acquired infections. That's a patient safety issue. All of this is a patient safety issue. The VHA is a healthcare system. Its product is patient care. This isn't like, the IRS, where it's, filing your tax forms or looking on, whatever. These are human beings, vulnerable human beings, and lives are at stake. And so when you deny people a voice, you make them afraid to speak up to defend their patients. And nurses and doctors will always say, oh, no, we'll always do everything to defend our patients. That's not true. People who are afraid of losing their jobs and their livelihoods will think twice before they make a fuss. And unions allow them to not do that and give them a voice. The other thing that's happening now, and that's super dangerous and that's harder to kind of, get across the importance of to the American public, is that Collins wants to restructure the VA. He wants to go back to where the VA was, before 1994, when Ken Kaiser took over as Undersecretary of Health, and for Health and reorganized the VA into a Veterans Integrated Service Network system, VISNs. And this allowed VA to, I mean, VA used to be, just a collection of hospital fiefdoms that had very little autonomy, but, they both had little autonomy and little ability to make decisions, and also the ability to make the wrong kinds of decisions. And that did not produce a cohesive, integrated national health system, which the VA is today. And that was done by creating a structure of, at that point, 22 regional entities called VISNs, Veterans Integrated Service Networks, whose role was to coordinate care. And the role of VA central office was not to approve purchase orders for pencils, and this was actually a true story, but, to really determine what are the strategic needs of an entire system to provide better patient care. And that, allowed, and I've talked to many people who were there over 30 years ago when the VISN structure was created. It allowed people to collaborate. It allowed people to share information. And it created the very successful system that we have today, in which VA outcomes are way better than the private sector and at lower cost. And they want to destroy that. And it's, it looks like, to a lot of people, that looks like just rearranging an org chart. Nothing could be further than the truth. Mike Bost has the chair of the House Veterans Affairs Committee has put forward a panoply of bills that would do all kinds of terrible things. Like, okay, for example, he wants regional directors, or what were VISN directors, to be political appointees confirmed by the Senate. That's completely crazy. Your medical director, your VISN director, your healthcare leadership should not be determined by political hacks and political connection, but by expertise. The VA, you have to understand, the VA is fundamentally the largest academic healthcare system in America. It's the only occupational healthcare system in America. And I would argue it's actually the only healthcare system in America, because what we have that calls itself healthcare systems outside of the VA are fundamentally just very poorly and ineffective episodic medical treatment systems, largely organized around profit. And what they're trying to do is both turn people into political hacks, like Tammany Hall, dependent on Tammany Hall bosses, and get rid of expertise, which they don't value, as we know, and destroy the system. And hopefully groups like this will join together and do much more concerted activity and organized activity and sharing of information to stop this. Many veterans who voted for Trump really felt like he wasn't going to do this. VHPI did a 8-state, swing state Facebook campaign around Project 2025. And it was quite interesting. We reached, tens of thousands of veterans. And a lot of MAGA or Trump supporting veterans responded in comments to our anti-Project 2025 message. And it was very interesting, because not a single one of them said Project 2025 is the greatest thing since sliced bread. Every single one of them who were voting for Trump said, you're crazy, he's not going to do this, he would never do this to us, he said he's never read Project 2025, etc. Well, now there's a lot of buyer's remorse in even the veteran community that voted for Trump, and that's something that we can take advantage of. And so I'm just hope that this overview is helpful. There's many other things that we could talk about. And I think that one of the main things we've seen over the last year is that this is an administration that throws things up against the wall to see what sticks. And when you make it not stick, they reverse. And our job is to make a whole lot of things not stick, and also to fight for an expanded and improved VA. So thank you so much.
Thank you, Suzanne. And now we have Irma Westmoreland from the National Nurses United.
Oh man, she's hard. Put me after her, huh? She's tough. She's tough act to
Yeah,
follow
she's our
there.
ace.
Yeah, that's right. Well, hi, I'm Irma Westmoreland. I am the Secretary Treasurer for National Nurses United, but I'm also the president of the VA division that we have for nurses, and we represent over 200,000 nurses across the country. But in the VA, we represent nurses that work specifically for the VA. And we represent over 16,000 nurses who have, of course, lost their bargaining rights, as Suzanne said, just like all the other federal workers. And I just have a few minutes to speak, and I meant to put my timer on so I would not go over my time. So hold on 2 seconds and let me do that. And one of the things that I was also surprised at was how many veterans really, really supported President Trump and swallowed the Kool-Aid. And there's also a lot of staff that voted for our nurses and our other unionists that voted for President Trump. And, what I tried to tell people is when you voted, I know you did not vote to get rid of your union, right? And everybody said, well, no. I said, well, that's what's going to happen here. And that is what has happened. But as Suzanne said, this was a plan from the very beginning. This should not surprise anyone what has happened. This should not surprise anyone that what this administration is doing, has done, and will continue to do is to fight 100% against anybody who will stand up to them. If you look at the documentation that came out in the court systems and what President Trump put in his executive order for the getting rid of the contracts for the nurses, and not just for the nurses, but all the federal workers across the United States, millions of federal workers, including all of the workers, 400,000 in the VA, was that the unions were standing in his way of getting what he wanted done and getting his plan done. That is what he said. That is what he put in his orders. That's what he put in his briefing papers, that the unions were standing in his way. And let me tell you, the unions are going to continue and have and will continue standing in the way of this administration and what they want to do to our veterans and what they want to do to our country and what they want to do to our citizens. I've told people that the president has come after the unions first, right? Because the unions are the people that have and are organized, have been through history organized, have been big organizers, have worked with every major change and every major improvement in our country for hundreds of years. And we have been a part of that, and we are going to continue to be a part of it. But the biggest way to tear down your enemy is to tear down the people who are supporting them, right? And in this case, that's what he's doing. Suzanne said it, and I will re-say it, but I do want to explain a couple of things that she said. And that is that they did, President Trump and Doge and Elon Musk and the group went around trying to devalue and vilify federal workers, right? Not just for the VA, but the Postal Service, the Social Security Administration, everybody they thought that they could vilify so that the country would look at us as the villain and the enemy, right? And so when you start attacking the people that the country thinks is the enemy, then they won't be supporting them. They did a very good job in the PR department of vilifying federal workers. They vilified not just all the federal workers, but the VA workers as well, telling folks that you can get the same care in the public that you can get at the VA. And that is a bold-faced lie. The care given at the VA is based on hundreds of years of research on how to care for those who have borne the battle and their support. And we have done that by researching the things that cause injury, how to treat those injuries, mental and physical injuries that have occurred to our veterans. And we continue to do that. Our medical system, and it is a loose word system because Suzanne is right, it's episodic care. It's not a system. The VA is a holistic care, head to toe care for our veterans, their spiritual care, their mental care, and their physical care from the time they come in the military till the time they leave and until the time they die. We care for them all the way through. And we have promised them when they come in the military that we're going to care for them. And what we're doing now is dismantling that. We have started from the time we set it as a country, and we continue to dismantle that and take back the things that we said we would give our veterans. And the VA is standing on the precipice of being put out of business. Because what happens is you take the roller coaster and you start trying to go up the hill, and it's really slow to get up that big hill, but when you get to the top it rushes on down to the end and you're done, right? And that's what they're trying to do now with how they're doing what they're doing. They're cutting positions, and they have cut positions, but what they've also done is prevented us from being able to fill positions. They've prevented us from being able to fill positions for a year. So now, as Suzanne said, positions you haven't filled for a year, we got to get rid of them. Well, they've prevented us from filling them. They wouldn't allow us to fill positions from March till June unless you were approved by the Secretary's office at that level, central office level, to get positions approved to be filled. And we've not been allowed now to fill positions from the end of July. So we had a couple of months where we could fill a few positions, and then September up until November, we haven't been allowed to fill hardly any positions because the Secretary Collins and the government were looking at what our positions were going to be and how much our funding we were going to have and how much we were going to have to fund the federal government and fund the VA, and based on that, how many positions they're going to have. So we couldn't fill positions then. So now what they've done is we've had a self-fulfilling prophecy. People who are tired of working short-staffed have left the VA and are going to continue to do that. People who could retire and are tired of being harassed and being in a harassing work environment have decided to leave, who could leave. And so they've taken advantage of that, Secretary Collins and the administration. And now we've got, when we were going to summarily fire people, but then brought that back and said we weren't going to rift. But then that gave the public the thought that why would I come and work for the VA when I have to work as a nurse for 2 years on a probationary status and can be fired for anything, almost anything, two notices that you did anything wrong they did not like, and you're terminated for no reason. So you have to stay 2 years before you get off for probation. If they can fire you summarily in a 2-year period, why would you come to work for the VA when you know that they are then going to look at rifting people, and the first people that are going to be rifted or fired is the people that are in probationary status? So for 2 years, your job is very precarious. If you go to work at the hospital across the street in any town, you have a 90-day probationary period, some only 30 days. Some very rarely 6 months, maybe. Maximum is mostly 90 days for about 80%. And so why would you work for a place that you could be fired summarily for 2 years? So we've set processes in place to prevent the hiring to happen. We've paid people inappropriately. We pay us well below there's laws in place that say we can't be pay leaders in any area that we're in. And so we set it up so that we are going to pay our workers less. We take away their rights to stand up for protections and to stand up and say that things are wrong. And they say, oh, we have whistleblower, but whistleblower is only for certain things. And for patient care issues, the ability to stand up and say, what you're doing, physician, right now is wrong for this patient, when that guy can just go to the next guy and have you fired. Right? Because his friend likes him better because he brings in more money than you, the nurse, do, right? They're going to keep him. They're going to let you go. And so there's a whole big myriad of things. Our contracts put processes in place that nurses, doctors, and employees could bring issues forward that were unsafe and have them addressed. That could make safe and stable working conditions. When people are psychologically safe and have safe and stable working conditions, then they can provide safe working environments and they can do a better job. I'm on a conference call, please.
Scream at me. Irma.
I'm sorry, my thing, I hit the mute by mistake. I'm sorry. But I just want to just say that those are really important things that she has said. And I reiterate that. But I also want to tell you that at the VA, all is not lost. There are still people who care about the veteran every single day. There are still people who come every single day to the VA wanting to do a good job and to put their best foot forward every day to care for that veteran. And we believe that the VA is the best place, absolutely, to get care for our patients. And we're every day going to continue doing that. We're every day going to keep coming until the doors are shut. We're going to come every day telling that patient that this is where you need to be, and we're going to provide that care for you. We're going to be holding that veteran's hand when he comes through the door, helping him walk through the door the first time and show him how to get access to care until we roll him out the door on the backside when he's passed away. We're going to hold his hand when he's got pain. We're going to help him get access to care, and we're going to provide that care. That is our job, and we come every day to do it. I don't care what this administration says. The nurses, the doctors, and the workers at the VA are strong people. We're not going anywhere, and we're going to keep working and keep standing up and keep saying, no, we're not going away. You're not going to make us. We're going to take care of the veterans, and that's what we're going to do every single day. Thank you.
Thank you. And now for Bruce Carruthers.
Hello, can you hear me?
Yes.
Yeah, I was a little bit late. I had a hard time getting on for some reason, but I wanted to talk just for a few minutes about the Save Our VA campaign that's part of Veterans for Peace. I'm not sure. I think everybody probably saw the bios. I'm an Army Vietnam veteran. I'm a retired VA employee, and I received my health care at the VA Medical Center in Asheville, North Carolina. But before I talk about Sova, I want to reiterate a couple comments that were made, particularly by Irma. I worked for the VA for 30 years in 10 different locations. One was in central office in Washington. The other 9 were at VA facilities across the country. And the VA has an extremely dedicated cadre of employees, all the way from housekeeping aides up to doctors. The example I always tell people is I never saw a person walk into a VA facility that looked a little confused, that the first person that saw that individual or that family didn't walk up to him and say, "Can I help you?" And I know when I go to the VA Asheville, I receive helpful, courteous service from everybody. I've had experience outside of the VA, and that is not the case often. You don't get the same sort of service. But just take a few minutes to talk about Sova. The Save Our VA campaign has a long history. There have been several iterations of it. The current one is about 5 years old. Our core group of people have been doing that. Jeff Roy, Arliss Herm, Mark Foreman, and I have been involved in this since we had the advocacy conference that was organized in Washington, D.C. I want to talk a little bit about what kind of things does SOVA do. Arliss produces a tri-weekly update, and that update almost always has a call to action. And the call to action is a letter that we've written that goes to members of Congress, the House and Senate, or sometimes both of them, primarily about pending legislation, sometimes about other issues. It's a very easy thing to do. We ask that you personalize it, and that can be as easy as saying, you can type in the beginning, I'm Bruce Carruthers, I'm a Vietnam veteran. I'm writing to you about. That's all you have to do. It automatically sends the call to action, the letter, to the appropriate members of Congress. You don't need to address anything. You just need to take 3 or 4 minutes to do that and send the letter off. We have a website as part of the Veterans for Peace main website, and Arliss primarily keeps that up. We work very closely with Suzanne Gorton and the Veterans Healthcare Policy Institute. Suzanne's on our steering committee, and I'm on the steering committee for Veterans Healthcare Policy Institute. We contact members of Congress, primarily staff members of Congress that we've made contact with, either through Zoom meetings or primarily through our advocacy conferences in Washington, D.C. We've developed relationships with them. And in addition to the calls to action that we send out, we send individual emails to them, updating them about issues, sending them links to articles, copies of articles, of things that are of concern to veterans about VA healthcare. We've tried to maintain contact with local efforts. We have people who are not on our steering committee, but that we have contact with, that we talk to them about whatever local effort, the demonstrations at VA facilities, the kind of things they're trying to do. Jeff Roy, who I think is on the call and is the coordinator of the Save Our VA Steering Committee, does most of that work. We, when we can arrange it, we have Zoom calls with members of Congress about specific issues. And as I mentioned before, it's generally the staff. It's rare that we actually get to talk to a member of Congress, and that's understandable. They're pretty busy, and it's the staff people who are responsible for VA affairs who really know more about that and who influence the members of Congress. So in some ways, it's as important or maybe more important to have a good relationship with these staff members. We appear on webinars like this, webinars that VHPI has organized, other kinds of webinars we've been invited to. We've been on several radio shows. We write letters to the editor, and we make personal presentations on the Save Our VA. That is, we're a small group. It keeps us pretty busy, and those are basically the things that we do. The last thing I want to talk about is, what do we need? Well, first and foremost, we need more veterans to sign up for the updates and send in the calls to action. We're lucky to get about 20% of the people who get our updates actually send a CTA in, a call to action in. It only takes a few minutes. And so we really would like to encourage all of you and the people you know to go to the Save Our VA website, and in any search engine, you can just type in Save Our VA. It'll take you to the website, and you can see the calls to action. You can sign up. You'll get the tri-weekly updates, and that'll have the call to action in there, and you can do that. We encourage more people to do that. If we could get 500 or 600 going out every 3 weeks instead of 200 to 300, it would have a big influence, especially if people personalize it. From the research we've seen, if congressmen get an email or letter and it's personalized, it has a much greater effect than if it's not. So take a few minutes and say, I'm a veteran, my father's a veteran, my brother's a veteran, people in my family are a veteran, I support veterans. Just something to let them know that this is not just a routine letter, that you've actually looked at it and you personalize it to some extent. The second thing that we need people from congressional districts for the House Representative who are willing to join us on a Zoom call to discuss veterans issues with the staff of the members of Congress. We can't get a member of Congress to respond to a request for a Zoom call unless we have a constituent with us. The constituent doesn't have to worry about being trained in the issues. We'll talk to them about it and we'll take the lead on it if we have to, but we need a constituent to do that. And Jeff Roy works in a lot. We have a hard time getting people to agree to do that. It's a simple thing. It doesn't take but about 20 minutes because that's about the most time you can get. We just need the person so when we write in, we can say, John Smith, a constituent, would like to request to have a conversation with you, a Zoom meeting. And then lastly, we need people who are interested in implementing the ideas they have to work with us on the steering committee or at a local level. We get a lot of ideas for things to do, far fewer people who are willing to implement those ideas. We have more than enough ideas. We don't have enough people to implement them. And so if you have a good idea of something that could be done and you're willing to do the work, we would like to hear from you. Or if you want help at the local level, if you have a good idea and you'd like to talk to one of us, we have materials we can send to you that will be helpful. If you need somebody to discuss the issues, if you need articles about the issues, we can provide that kind of information to you. And I think, I don't want to take any more time, but I think Jeff Roy is on here. Jeff, did you want to add anything?
Thanks, Bruce. No, I think you've covered everything beautifully. And again, we appreciate everything that those of you who are on this call have done to support veterans, support the VA, and in your own way support the Save Our VA campaign. So we will continue to work on it and do the best we can. Thanks.
Hey, thanks, everybody. And Jeff is too modest sometimes. Jeff is a chair of steering committee, and he does an incredible amount of work contacting people, setting up meetings with members of Congress. He's our fearless leader.
So our last speaker is Mark Smith from FUN, the National Federation of Federal Employees.
Hi, everybody. Thanks so much. My name is Mark Smith. I'm an occupational therapist and health educator. I've been serving veterans for about 12 years now. I'm also the president of National Federation of Federal Employees, Local 1, representing healthcare workers at the San Francisco VA healthcare system. And I'm also with the Federal Unionist Network, which is a cross-union, cross-agency formation of federal workers all across the federal government, trying to unite and fight against all of these attacks on the public services that we provide. And the privatization at the VA is one of those fights. I just want to say also, I'm always so inspired, and I learned so much from the incredible advocates on this call, Irma Westmoreland and the NNU nurses. We're always so inspired by them. Remember when I went to our legislative week and I saw, like 100 NNU nurses in the red scrubs marching. I think Congress must have been terrified, so that sort of thing. And, Veterans for Peace, just really, really inspired by all the work that you all have done over the years. And whenever we host an informational picket or do some event, a rally for veterans, it's always Veterans for Peace members that show up and are, leading those rallies. And thanks so much to Suzanne Gordon and all the incredible data and information and analysis that you provide so that we can, use that in our advocacy. So I'm incredibly passionate about the VA's public mission and the, obviously the high quality, low cost healthcare that VA provides to millions of veterans and their families, as well as the thousands of healthcare professionals that VA trains, right? That's a critical part of the VA's mission that serves all Americans, and then also the world-class research that VA produces. I feel very proud to work at the VA as a public institution. I think it's a model of what healthcare could and should look like in this country for everyone, right? So I'm from Canada originally. I enjoyed universal healthcare in that country. The VA is a model that everyone in this country should enjoy. We need to protect it for the veterans that it serves, but also so that it can continue to be a model and an example for veterans. My little brother is a Marine Corps combat vet, and my grandfather was a World War II Army vet who he was a machine gunner and marched under General Patton. He was fought in D-Day, all that kind of stuff. He had cancer, and at the last end of his life, the VA took incredible care for him. That was in upstate New York. I think it was the Syracuse VA. But this incredible system is facing critical threats, like you all heard already. The VA press secretary, as you all know, came out with a straight face saying that cutting 37,000 frontline healthcare positions won't impact care because the positions aren't needed, right? So to quote my grandfather, he was known to use a colorful phrase or two. He would say something like, Mr. Secretary, with all due respect, please don't piss on our boots and tell us it's rain, right? This is obviously a disingenuous statement that these cuts of this magnitude won't impact care. They want us to believe that cutting peer support specialists, those vets who help their fellow vets get connected to care, that's not going to impact care. They want us to believe that cutting psychologists and social workers who provide that critical frontline mental health treatment, when their caseloads are already maxed out, that's not going to impact care. I don't believe that. They like to have us believe that cutting nurse positions when our bedside nurses are already, can't take breaks due to lack of staffing, that is going to impact care. They like to tell us that cutting social work positions, including, emergency room social work positions where, those folks ensure veterans get the resources that they need in a crisis, that won't impact care. We don't buy it. Cutting all of these positions, saying they're not needed because they have been vacant for a year, it's a little bit like throwing out your fire extinguisher because your house hasn't caught fire recently and you've got a sink and a bucket. It's a disingenuous statement and it's reckless, and we're not going to stand for it. This might even make sense. We're all healthcare workers. We understand the need to triage limited resources, but this is not a budget crisis. As we've heard, it's a policy choice. The VA secretary and the corporate forces behind him are choosing to divert billions of dollars of VA funds. They're choosing to divert those funds to private healthcare system that is just not equipped to care for veterans. It's barely equipped to care for anyone, as we've seen, and you can see from Suzanne Gordon and the VHPI's excellent report that the healthcare system is just not equipped to take care of vets. So we're trying to reverse the cuts, all of them. We want to bring back all of the positions. We want to restore our collective bargaining rights for VA healthcare workers. As Irma mentioned, those help us speak up for our patients, and to fully fund and fully staff VA's public mission. But obviously we're calling on the Trump administration and Secretary Collins to do those things. We're not naive enough to think that they will suddenly change their minds because we asked nicely. And that's why we're, taking collective action, and we need everyone to be a part of it. It's not enough just for veterans to be advocating for the VA these days, right? There's just too many crises happening. There's too much going on. We need to have a coalition. We need a lot of people advocating for our VA and this public mission. So we're trying to build a coalition, right? Veterans, unions, union veterans, federal workers who work at the VA, or federal workers who work across the federal government, veterans who are in unions who might rely on the VA for their care, folks who are healthcare advocates who might not see the VA as a critical piece of the American healthcare system and as a model for things like Medicare for all. Those are folks that we need to be talking to and bringing into our coalition. So I know I'm already over my time here, so I'm just going to post this link in the chat. And this is a little sign-up form if you would like to get in touch with the Federal Unionist Network, and we can try to connect you with folks who are advocating or getting active at VA facilities around the country, or in cities and towns near you. And I will just share finally a little quote, because we're in difficult times. And we need some hope. One of my veteran heroes, Howard Zinn, who was a World War II pilot and historian, he said, "To be hopeful in bad times is not just foolishly romantic. It is based on the fact that human history is a history not only of cruelty, but also of compassion, sacrifice, courage, and kindness. If we remember those times and places where people have behaved magnificently, this gives us the energy to act. And small acts, when multiplied by millions of people, can quietly become a power that can transform the world. So thank you so much, Solidarity, and I'll turn it back over to our hosts.
Yes, I would like to ask either Bruce or Jeff to tell people how they can get involved in saving the VA.
Well, I can certainly repeat some of the things that Bruce has indicated. People want to get involved with the Save Our VA campaign. Get a hold of us, and hopefully folks will have our contact information. I'd have to put it in. But the other thing is that when you, if you have, as Bruce was saying, if you have a idea of how you could work to help Sova, and are willing to take on that task, that's the key thing. Get a hold of me, and we can talk to you further about that. And we'd love to. I think that at this point, that's enough.
And how can they get a hold of you, Jeff?
Well, my email is my name backwards. If you want to do that, it's royjeff48@gmail.com. I'll put it in the chat.
Is it also on the website, the VFP website?
I believe it is, but I'll just make sure that you have it here.
And Bruce, do you have anything to add?
Yeah, as I mentioned before, so if you're really interested, just in any search and put Save Our VA, it will take you to our website, and you can see the issues that we're working on. You can see our calls to action and the sort of things we're doing. So I think that's a good starting point. One other thing I should point out, if you really want to know what's going on in the VA healthcare system, the very best source is the Veterans Healthcare Policy Institute website. So if you Google that, you'll find all kinds of analysis, articles that Suzanne and Russell have written, analysis of legislation. So those are two things you do. If you want to be informed, go to the VHPI website. If you want to get involved besides content, take a look at our website and see the things that we're doing and the kind of things we're working on, and that'll give you a good idea of what sort of help we need.
So that's what website, the Veterans Healthcare Policy Institute?
Veterans Healthcare Policy Institute, that's Suzanne, and that's where you can get the best information on what's going on with VA healthcare. The Save Our VA website is the Sova website, and that's where you can find out what the Save Our VA campaign is doing and ideas that you might have, or our calls to action, the updates, all those sorts of things. How you register is on that.
And isn't there a page on the VFP website for
It is on the
Sova?
VFP. It's part of the VFP website. So if you go to VFP, you'll find it. But if you just put in Save Our VA, that should take you right to that part of the Veterans for Peace website. That's a good point. Thanks for mentioning that, Patrick.